Hello, welcome, and thank you for joining our webinar titled Aligning Early Childhood Systems Through Shared Outcome Measures to Support Nurturing Family Environments. And an acknowledgement that this webinar is made possible because of our partnership with the Health Resources and Services Administration. And before we dive in, I just want to kick us off by introducing folks whose faces you'll see and voices you'll hear throughout the presentation today. I'd love to start off by introducing our wonderful partner who has been a great thought partner in developing this webinar for you all. Lyana, would you like to say hello to everyone?
Thanks, Anna. Hi, everyone. My name is Lyana Delgado, and I am with the Division of Home Visiting and Early Childhood Systems at HRSA. I'm very excited for this session with you all today. Turn it back over to you, Anna.
Thanks, Lyana. And my name is Anna Corona-Romero, and I'm a senior specialist for child and adolescent health systems initiatives at the Association of Maternal and Child Health Programs, or AMCHP for short. And I'm delighted to be joined by my two colleagues, Mara and Paige. And Mara, if you'd like to say hello quickly, and Paige, you can follow Mara.
Hi everyone, we're so excited to see you all here today. I'm Mara Leahy. I'm a Senior Manager of Training and Technical Assistance here at AMCHP for our Child and Adolescent Health Initiatives.
And hi, everybody. I'm Paige Bosanich, and I am the Associate Director for Child and Adolescent Health at AMCHP. Thanks, Anna.
All right, and we, as you know, through perhaps the promotion that you saw for this webinar, we have several folks that are leading early childhood programs from 3 different states joining us today, but they will introduce themselves as they do their shares later in the webinar. And for those of you all who don't know about AMCHP, I'm delighted to tell you about us. We are, of course, the Association of Maternal and Child Health Programs, and you can say AMCHP for short. We are a national nonprofit, and our offices are based in Washington, D.C. We are a national resource, partner, and advocate for state public health leaders and others working to improve the health of women, children, youth, and families, including those with special healthcare needs. And as you see in our mission, we are really focused on advancing the health of women, children, youth, families, and communities by strengthening governmental public health and deepening community partnerships. And if you would like to learn more about us, please head to our website. It's amchip.org, and you'll see a lot of different resources that hopefully you'll find useful for your work. Our objectives for today are first to provide you all an overview on key federal early child investments that contribute to really important outcomes that I know you all really see yourselves as a part of driving, that include child flourishing, school readiness, and prevention of adversity. I will say here, there's going to be a lot of information on the slides. We are doing that on purpose because we want the slides to serve as a leave behind for you all. So know that you'll receive the slides, know that you'll receive the recording. And if that allows you to sort of relax and sit back and just focus on listening, we welcome that, and know that you'll have these afterwards. After we level set the various programs that we're going to be highlighting today, we're going to spend some time emphasizing how the Title V program's national outcome measures can serve as a shared framework or an anchor or shared language to support the work that you all are already doing to align early childhood systems in your states and jurisdictions. And then finally, the real bread and butter of our webinar today, we are going to hear from 3 different states and folks who lead programs in those states to talk about how they're operationalizing this idea of using measures to really anchor collaborations with various early childhood programs in their state. One more thing I want to just say here, if you have questions throughout the presentation, please put them in the chat. If we have time, we will spend some time answering them. If not, my colleagues are going to be gathering those questions, and we will send responses to your questions alongside the slides and the recording after this webinar concludes. All right, a quick flow of what to expect today. Lyana and I are going to spend some time doing background and level setting. Then we're going to turn it over to leaders in Massachusetts, Ohio, and South Dakota to share about the work that they're doing and share examples of how they're embodying the alignment that we're chatting with you all about today. And then we're going to go into a choose your own breakout room scenario. And my colleague Mara is going to describe and explain what we mean by that when we get there. And then we will wrap up with some quick reflections and close out. All right, so I'm going to hand it over to Lyana to kick off our background and level setting for us.
Thank you, Anna. Move to the next slide. So the Maternal Child Health Bureau, or MCHB's mission through HRSA, or the Health Resources and Services Administration, is to improve the health and well-being of America's mothers, children, and families. Our vision is an America where all mothers, children, and families thrive and reach their full potential. And today, these are the MCHB investments that we will be zooming in on. Next slide. Within the Division of Home Visiting and Early Childhood Systems, or DVECS, we focus this commitment on supporting pregnant women and our country's youngest children toward achieving a vision of creating communities in which all families can thrive and support their children to be healthy, nurtured, ready to learn, and succeed. And we improve the health and well-being of pregnant women and families, particularly those who historically have had lower access to care. And our investments seek to promote an upstream two-generation prevention approach that focuses on the myriad of cross-cutting factors that affect child and family health and well-being. And these approaches, they better enable us to achieve lasting long-term effects and to recognize and respond to the ways in which the needs of individual family members influence and are influenced by others in the family. And DVECS, again, delivers this through complementary programming of evidence-based home visiting, or the MIECHV program, and a growing broader early childhood systems portfolio that we'll talk about as well. Next slide. As a final takeaway, while these programs operate in different settings and at different levels of intensity, they all share the same goal of ensuring that families receive the supports they need during the critical prenatal to 5 period to build a strong foundation for lifelong health and well-being. And our programs facilitate early identification and intervention and reduce or directly address negative experiences, enabling families to get what they need, leading to improved health and social outcomes for whole families. Our programs do this by improving the health and well-being of families, by meeting families where they are, and that can be whether it's in the home, the pediatric office, child welfare system, or through statewide systems of care, as well as starting as early as pregnancy, engaging caregivers and children together, and promoting safe, stable, and nurturing relationships. And together, these programs form a continuum of support, starting with the Maternal, Infant, and Early Childhood Home Visiting Program, or MIECHV, which provides intensive home visiting services. Then our Infant Toddler Court Program, which we have also referred to as ITCP, which supports families involved with or at risk of child welfare. Our Transforming Pediatrics for Early Childhood, or TPEC program, strengthens pediatric care through integrated early childhood expertise. And the Early Childhood Comprehensive Systems Program, or ECCS, which builds the systems that make coordinated services possible. And as states, tribes, and territories, and those of you that are on this call, plan for maternal and early childhood efforts in the upcoming year, we welcome opportunities to continue to strengthen those partnerships, maximize these complementary funding streams, and advance the shared goal of helping every child and family thrive. Next slide. So to start with our MIECHV program, which continues to demonstrate strong results, and the recent funding increase presents an important opportunity to expand its impact. Compared with fiscal year 2022, the program now supports 11% more full-time home visiting staff, with a workforce of nearly 4,500 professionals serving approximately 158,000 caregivers and children across 1/3 of U.S. counties. And we are also continuing to see improvements in key maternal and child health outcomes. In fiscal year 2025, 81% of caregivers received a depression screening within the recommended time frame, and 77% of mothers received a postpartum visit within 8 weeks of delivery. And MIECHV families also continue to outperform national comparisons with higher rates of timely well-child visits and safe sleep practices. And as an indication to continue growing the success of MIECHV, the program has been appropriated $800 million in funds for the upcoming fiscal year. And states are planning now for how to invest these resources for fiscal year 2027. And this really is an ideal time to strengthen those partnerships, as well as maximizing available resources and align efforts. And we're also making updates to the MIECHV performance measures in fiscal year 2027 to better align with Title V and other HRSA programs, making it easier for states to coordinate and measure impact. Next slide. Our Infant Toddler Court Program, or our ITCP program, which includes two complementary components: state awards, which build state and local capacity to implement and expand the infant toddler court approach, and the National Resource Center, which leads national efforts to strengthen policy, practice, and evidence while providing training and technical assistance to support implementation. An evidence-based infant toddler court approach, such as Safe Babies, brings together judges, attorneys, child welfare professionals, peer supports, and early childhood experts to address the needs of families with infants and toddlers involved in or at risk of entering the child welfare system. And community coordinators and judicial champions help the local teams improve court practices and connect families to critical services, including developmental supports, substance use treatment, as well as parenting education and stable housing. And together, these efforts help reduce child maltreatment as well as strengthen healthy parent-child relationships and improve outcomes for infants and toddlers. And the National Resource Center is currently completing an evaluation that will highlight both the family outcomes and systems level impacts of the Safe Babies approach. And looking ahead, this program will be recompeted in FY27, so we encourage you to watch for future funding opportunities on grants.gov. Next slide. And HRSA launched the Transforming Pediatrics for Early Childhood, or TPEC program, in 2022 to integrate early childhood development experts into pediatric settings, serving children from birth through 5, with a focus on families covered by Medicaid, CHIP, or who are uninsured. And TPEC strengthens pediatric care by embedding early childhood experts on care teams, improving developmental screening and family support, and building statewide capacity for team-based care. And the program also emphasizes strong partnerships with families and communities to ensure services are responsive to their needs. So more explicitly, TPEC awardees place early childhood development experts in pediatrics practices to deliver early childhood services as part of a team. Additionally, they build the skills of health professionals statewide to deliver team-based early childhood services, and they expand and sustain team-based early childhood services to improve the standard of care for young children. We're currently reviewing the applications for the next round of funding for the TPEC awards, with awards expected by the end of this fiscal year. And this funding cycle places an even greater emphasis on child flourishing, stronger alignment of performance measures across HRSA programs, and closer coordination with Title V to support lasting improvements in early childhood care. Next slide. To finalize with our Early Childhood Comprehensive Systems Program, or ECCS, which was established in 2002 in response to MIECHV's strategic plan, calling on Title V agencies to bring together partners to improve school readiness and early childhood outcomes. And over the past 2 decades, ECCS has helped states strengthen cross-sector partnerships, engage families in planning, and build governance structures that reflect community needs. So what this means for families: easier access to care through better coordinated systems, stronger family voice in shaping policies and programs, earlier support for developmental and health needs, and faster connections to services through shared systems and data. Our current funding opportunity for ECCS, which is titled the Early Childhood Comprehensive Systems, Scaling Effective Early Childhood Systems Development, or ECCS SEED, represents the next evolution of this work. ECCS SEED moves from solely supporting statewide efforts to seeding community-wide implementation. And this is backed by state leadership to establish impactful and scalable systems of care for the prenatal 5 families in high-need communities, which include rural areas. And states are also advancing priorities such as early relational health, school readiness, developmental screening, and family leadership while building scalable systems of care. We're also currently reviewing applications with these awards expected by the end of this fiscal year. And the new competition emphasizes, as mentioned, child flourishing, stronger alignment of performance measures across HRSA programs, and with Title V, and continued focus on well-child visits and other shared measures, helping ensure that the strong strategic planning translates into measurable improvements for children and families. I will turn it back over to Anna.
Thanks, Lyana. And there is one quick question in the chat that I think we have time for is there any overlap or commonalities between ITCP and the 0 to 3 Safe Babies Court program?
Definitely. There are lots of connection points, particularly in that our 0 to 3 is our National Resource Center partner.
Okay, Great. All right, and thank you, Amanda, for responding in the chat. All right. So thank you again, Lyana, for sharing about the investments that your team at your division at MCHB administers. And I'm going to shift us over to the Division of State and Community Health, which is another division within the Maternal and Child Health Bureau that administers the Title V Maternal and Child Health Block Grant. And the team over at the Division of State and Community Health are also great partners of ours at AMCHP. So I'm just delighted to share with you that their mission is to support the health and well-being of all mothers, children, and families through the Title V Maternal and Child Health Block Grant, which is a federal-state partnership authorized in 1935 by the Social Security Act. So it has been around, the Title V Block Grant has been around for a very long time. It has evolved since 1935 to become the block grant that it is today. Here, I wanted to share with you all, again, the purpose of the Title V Block Grant is very similar to the purpose that you've been hearing across programs, but it really is to improve the health and well-being of mothers, infants, and children and youth, including those with special health care needs. And what's unique about Title V is they have a real strong focus on strengthening the public health systems that serve children and families. You'll see on this slide here just a few of the key metrics that Title V programs can select and report on through their programming. There are several more, and I'll show you how you can take a look at what those are later in the presentation. But for now, I just wanted to highlight two types of measures that Title V programs report on, one being performance measures, and these are specific to child health. So you'll see those there on the screen listed: housing and stability, food sufficiency, and developmental screening. And again, that's not all of the child health measures, just a few select ones to give you an idea of what Title V is measuring. And then more specifically, I wanted to point to these outcome measures. Those are child flourishing, school readiness, and prevention of adverse childhood experiences, or ACEs. And I want you to think about what those outcome measures mean to you in the programs that you lead and how your programs also contribute to those outcome measures, because we're going to dig into the importance of those outcome measures in just a moment. I also just want to highlight the reach of Title V programs, serving 92% of all pregnant women, and this is across the country, 99% of infants, and almost 2/3 of children. And again, this is nationwide. The block grant is wonderful because it allows states to be flexible to use that funding in the way that meets the unique needs of their state or their jurisdiction. And so if you want to see how Title V is having an impact in your particular state, I'd encourage you to take a look at their publicly available application and annual report, which again, if we have time, I'll walk you through how you can do that and check that out. I'm going to do a little bit of a deeper dive on Title V programs. I think they are an essential partner in all of this work. Each of your programs are essential partners in early childhood systems building work, and Title V has a unique vantage point. And so every 5 years, Title V programs are required to conduct a thorough and comprehensive needs assessment that can take the better part of a year. That includes them traveling around the state, listening to different partners, listening to families, listening to communities, and gathering the information and the story that they need to identify what their specific state or jurisdiction's maternal and child health needs are. And because Title V programs have such a comprehensive view of maternal and child health systems in that state, they're really positioned as a state MCH strategist. They have an abundance of data to inform how Title V utilizes the resources that they have through their block grant. And so the needs assessment really informs the infrastructure support and the systems building support that Title V will provide for the maternal and child health system, including early childhood systems. And so this is just, if nothing else, Title V is a really great partner to connect with if you're not already. If you have questions about anything about the early childhood system, who's doing what, where are there gaps, where are there opportunities to connect? And I put on this slide here that Title V plays many critical system infrastructure support roles. And on this next slide, sharing some of what those are. The AMCHP team did a focus group back in 2024 with several Title V leaders to really understand what is the role that you play in early childhood systems building in your state. And these are some of the roles that we heard. And I will say too, this isn't specific to early childhood. Title V will play this role for maternal health, infant health, adolescent health, and for children with disabilities as well. But you'll see here, because Title V has that really comprehensive view of the needs and the opportunities to strengthen MCH systems in the state, they are a natural convener of partners because they know who they can or who has opportunity to be connected to strengthen that system and make sure families get the supports they need when they need them. In addition to being that natural convener and connector, Title V has a big role in building the data infrastructure in the state. Title V programs have a really good understanding of what's the data that's available that can tell the story about what families are experiencing in our state, where we're doing well, where there's opportunity to improve. But there are cases where Title V is also creating data sources to understand a need that perhaps federally available data sources don't necessarily allow someone to understand what those needs or gaps might be. Title V is also very much focused on that policy and systems support and approach for improving maternal and child health outcomes. Title V programs do provide some direct services. They do provide some enabling services to ensure that people can reach the services and families can reach the services that they need. But most of the resources are really focused at that systems level and thinking about how to strengthen and better connect systems. Finally, not finally, but family and community voice uplifter is a key role that Title V plays. I know that many of your programs also do the same. Family and community voice is an important and required component of the needs assessment, but many Title V programs continue that engagement, not just during the needs assessment, but throughout how they develop, implement, and evaluate their work and their efforts. And finally, I'll say here, many Title V programs will award part of the block grant to local health departments or community-based organizations in their state to do more local level work that is going to advance and address the priority needs that were identified through their needs assessment. So I'll pause here. I know that was a lot of information that you all received. We're going to transition now, or I'm going to transition now from that level setting of making sure everyone understands, at least at a high level, what each of these programs are doing individually. And now we're going to move over to exploring the measures that really present an opportunity to serve as an anchor across all of these programs and even more programs to promote shared action. What I just want to say here, and the point I want to emphasize here is that, again, I mentioned that Title V is well positioned to be a convener and a connector, and I know many of you who lead other programs also play a similar role. And I will say that the outcome measures that Title V is reporting on around school readiness, child flourishing, and prevention of adverse childhood experiences just reinforces that role, again, because there is that opportunity to use these measures as a common language that allows all of your different programs that have unique roles and perhaps slightly different missions to really start thinking about how you're driving toward the same destination. And these outcome measures really serve as an opportunity to be that shared destination for your programs. And the other thing I want to say here is that this alignment and this shared language about where your programs are driving towards doesn't require you all to do more. It really just is requiring a conversation for each program to come together and think about how does your specific program play a unique role towards this shared direction that our state together cohesively is moving towards. And then finally here, I just want to say that each of these measures that you see on the screen here are ultimately going to be indicators of what I know everyone sees themselves here. Everyone here sees themselves working towards supporting the presence of nurturing family environments. On the next few slides, I'm going to just give you a brief overview of what each of these measures is actually quantifying. I know we'll have folks who have questions about the measures themselves, and so I will go through those briefly, just to give you an idea of what we mean by each of these outcomes. And again, as we're going through these, I want you all to keep in mind how you might think of these measures as a common language, again, that allows programs that have slightly different focus areas to still work towards the same destination. So for school readiness, this is a measure that is looking at children ages 3 to 5, so that preschool, kindergarten age, who are meeting developmental expectations in 4 out of the 5 domains that are listed on the slide. So a point here is that this is a composite measure. Another point I want to make here is that this is a parent-reported measure, and so this really requires engagement of parents, caregivers, and families, which we think is the strength of this measure. And for each of them, these are all from the National Survey of Children's Health. And at the bottom of the slide, you'll see a link where you can see how your state is doing or how your jurisdiction is doing based on the most recent data available. Next is flourishing for the young child. The age range has widened here. This is from 6 months to age 5. And again, a parent-reported composite measure that is looking at 4 areas. So is your child always or usually affectionate and tender with you? Do they bounce back quickly? Are they showing interest and curiosity? And do they smile and laugh a lot? And then finally here we have adverse childhood experiences. Again, the age range is broadened even more beyond early childhood. You'll see 0 to 17 here. This is included because early childhood is in that age range, and we know the importance of preventing adverse childhood experiences as early as possible, obviously continuously as children grow, but the importance of preventing them early on. I am looking at my time, and I don't think I have time to go through these fully, but I wanted to share with you all, if anybody is interested in anything about Title V, this is the place to go. It's the Title V Information System, known as TVIS for short. You can go here and learn more than you ever thought there was to learn about Title V. The measures, you can see state snapshots, you can see percentage of folks served, you can see the full application. And so in these slides, when you receive them, you'll see we've pulled out 3 different things you might be particularly interested in. But if you want to explore the performance measures and see the full breadth of what those are, you can navigate to the screen here. There's also state snapshots. So if you're interested in what your state is doing at a glance with their Title V investment, you can go here. And if you really want to get into the nitty-gritty and review the applications, the block grant applications, sharing what a state is proposing to do in the coming year and what they've done in the last year, you can view state applications here. All right, so I'm going to be wrapping up here. This table, I want to give all the credit to my colleague Paige. She has designed this table to be at a glance visual that just emphasizes the point that there are many, many federal investments that don't just come from HRSA. There are many agencies that invest in early childhood through their programs. This is not an exhaustive list. The point here is just to show you that there are investments across agencies, and all of them play some role or even play a role in all of the outcomes that we've been discussing today. Again, the flourishing and school readiness, and then the prevention of relational and social risks. So on the left, you see all the agencies. In that middle column, you see the associated programs. And those 2 red columns are really indicating the outcomes that each of these programs play some role in. The takeaway here really is that each program has a different purpose and a different authority, but despite all of these differences, they're all working together to try to improve many of the same outcomes. And again, maybe sounding like a broken record now, but those shared outcomes really give folks a practical way to align your work without changing your program requirements. It's really just clarifying your role and that shared purpose. And again, alignment doesn't mean that every program does the same work. It just means that everyone is contributing their program's unique strengths and assets towards a shared goal. The yellow stars here are just representing that these programs are available located in every state in DC and most jurisdictions. So if you don't know of this program in your state, here's an action item you can walk away with, is figure out who is administering these programs in your state. The red star shows investments that are available in every state, all 59 states and jurisdictions. So that's community health centers and Title V. And then the blue star is really just emphasizing those programs that have a specific focus on systems initiatives. And so these folks, you might just reach out to say, hey, I know that you have a focus on systems. We're thinking about systems too. Let's just talk about that. So even if you don't approach from the measurement perspective, which could be a conversation you have down the line, you could approach just in the shared interest of improving systems. I'm wrapping up my section here. If this is the only slide that you pay attention to, that you take away, I will be very happy. This is the main point that we're trying to make here. What this visual is showing is that at the center of all of these programs is the opportunity for everyone to think about their work, which I know you already do, as moving towards and supporting nurturing family environments. And you'll see those 3 measures there that I walked through that can serve as indicators of how do you know in your state that you're moving or improving the presence of nurturing family environments. And the last couple of things I'll say here is that, notice that none of these investments replaces the other. Each is playing a distinct role in creating those conditions that lead to nurturing family environments. You don't have to build anything new. I know you all already have many assets in the way that you're implementing your programs, including the partners that you have, the data that you have, the infrastructure that you're building and supporting. And what the opportunity is here, and the big takeaway is that there is opportunity to really intentionally align your existing efforts around a shared outcome that you all are all driving towards together. And the direction that you're going, and you understand the unique role that each of your programs plays in your state. Okay, taking a breath to sort of let all that sink in for a moment. I know that was a lot. But now I am very excited to hand it over to our state presenters who are going to talk about how they actually operationalize everything that we just shared with you all. And so with that, why don't I cue up our friends in Massachusetts? All right, Eve and Roxanne, please kick us off.
Thank you. Good afternoon or good morning, everyone, depending on your time zone. I'm Eve Wilder. I work at the Massachusetts Department of Public Health. I'm the director of the Transforming Pediatrics for Early Childhood project. And I also serve as the lead of the Pediatric Medical Home Focus Area of our Title V State Action Plan, which we'll be talking about in a moment. But I'll pass it over to my colleague, Roxanne, to introduce herself first.
Hello, everybody. I'm Roxanne Hoke-Chandler. I work with Eve, and I am the Family Systems Coordinator for Family and Community Engagement at the Department of Public Health, the Division of Pregnancy, Infancy, and Early Childhood. Nice to see you all.
So Roxanne and I are going to speak today about collaboration across Title V in our Transforming Pediatrics for Early Childhood project, which have a shared focus on expanding access to high-quality medical homes for young children and their families, and strengthening the capacity of a multidisciplinary pediatric primary care workforce to provide family-centered early childhood services. To give you a little sense of our landscape in Massachusetts, our Bureau of Family Health and Nutrition within the Department of Public Health administers our Title V block grant. This is also the Bureau which houses our TPEC project and other services for young children and families, including early intervention, MIECHV, WIC, programs for children with special healthcare needs, and HRSA's Pediatric Mental Health Care Access Project, which partners with our state's Child Psychiatry Access Program to support primary care practices to address developmental and social-emotional concerns in young children. And they also provide training on early childhood social-emotional development to primary care practices statewide. And we partner with them really closely in our Transforming Pediatrics for Early Childhood project. So for Massachusetts, public health and Title V felt like a really natural home for our pediatric primary care transformation and capacity building activities, because we really have this intentional focus on promotion and prevention initiatives, as well as work to strengthen the service infrastructure and system of care for young children and their families. And our Bureau has been engaged in early childhood primary care capacity building work since 2008, and saw a real opportunity to create a permanent home and infrastructure for this work within Title V. So to formalize this link, we embedded strategies within our current block grant action plan, which you can see on the slide, within a pediatric medical focus area in the child domain. So these strategies really share and complement the goals of our TPEC project, which are to expand and sustain access to a multidisciplinary team-based primary care for young children. And really, our goal is to make this become the standard of pediatric primary care statewide. There's an aligned focus on both projects on growing and strengthening the early childhood development expert workforce in Massachusetts, and with specific attention to scaling the family partner role, which centers family voice and experience in the delivery of team-based care. The next few slides are going to go into more detail about the scope and impact of the family partner role, but before we advance, I wanted to share a little bit about our metrics. So we elected to report on the Pediatric Medical Home National Performance Measure for Title V. And we also developed an evidence-based strategy measure that looks at the percent of practices who are engaging in and completing our medical home early childhood capacity building activities through Title V, TPEC, through Pediatric Mental Health Care Access, to be able to track the spread of practices who are investing in transforming their care to provide high quality services to young children. Next slide, please. So we define a family partner as a professional who's uniquely trained to lead with their experience as a parenting caregiver. So this could also include a grandparent, a sibling, or another relative who's held that primary caregiving role, who has navigated systems to meet developmental and concrete needs of a young child. This peer role really does have deep roots in services for children with special health needs, and it's also existed in community-based mental health services for children, but it's still new in pediatrics, and it hasn't really been widely adopted. But our work through TPEC and through other work we've done within our Bureau has really shown that the family partner role is a valuable asset to primary care practices and teams. Family partners promote the delivery of high quality holistic care. Because they have that shared parenting experience, it helps to build long-standing and trusting relationships that strengthen families' engagement in their children's care. And it improves their family's experience of care by making sure that their needs, questions, and preferences are heard by the care team. They help promote shared decision-making and also help to model self-advocacy for the caregivers that they support. And we've also seen that family partners have a positive impact on the rest of the care team. We've heard from medical providers who practice with family partner that it decreases their burnout, their feelings of overwhelm, because they have someone who can collaborate to meet the kind of full needs of a child and family, and who can extend that support beyond a 15 or 20-minute well-child visit. Next slide, please. I just wanted to share this quote from a pediatrician at one of our practices that I think really nicely describes the power and impact of the family partner role. I'm not going to read it, but I think you'll have the slides after the presentation. But I just wanted to have you hear directly from a provider. Next slide, please. So even though we know, and there's evidence that family partners are important early childhood expert and member of a care team, as I mentioned before, the role is still fairly unknown, and it's not well understood by the primary care field. We've seen that family partners mostly exist in practices that have either received a grant or have a clinical champion that's worked with a family partner, and another practice has really advocated for the role. So a big part of our work in TPEC has been to map out the family partner career pathway, see where the gaps are, and start to develop strategies to really grow this workforce to ensure that more children and families have access to family partners in their medical home. I'm not going to dive into this deeply here, but I did want to acknowledge that there is a direct link between the financing strategies for family partners and workforce challenges. And we've done some work in our project and tested some strategies to explore a range of funding mechanisms to pay for family partners in primary care because their services aren't currently reimbursable in the state. So some of the gaps that we've uncovered include there's definite conflation between the community health worker and family partner role. The CHW role is much more widespread, it's better understood. And while the roles can share many of the same responsibilities, there is a real distinction in that the family partner is hired and receives training to really elevate and bring their parenting experience to a professional role. And so to that point, there are many more career resources for CHWs and for family partners, although we've really supported family partners to take advantage of some of those offerings, including receiving certification as a community health worker. And I'm going to briefly walk through some of our strategies on the next slide to address these gaps. So our workforce activities really fall into three categories: training, mentorship and team-based care support, and policy and practice. And at the bottom of the slide, I've highlighted some of our key partners that we've worked with across these different areas. So we've developed a set of e-learning courses, which are almost complete, to address the family partner knowledge gap in primary care. And they're really intended to increase awareness and understanding of the role, and also provide some kind of concrete guidance and resources on the infrastructure practice needs to successfully hire and integrate a family partner. And these are going to be widely disseminated across the state. And then I see we're getting close on time, but one thing that I did want to highlight, because Roxanne is going to speak to this, is that we've seen the value and importance of reflective practice for family partners as a workforce retention support. This is really invisible work, and that's something that's baked into the supervision structure or culture within practices. But our experiences have really shown that reflective practice is essential to sustaining the role, because there are unique challenges that present for staff who work in a peer role, both in their relationships with families and with colleagues, that can really lead to or worsen stress or burnout. So Roxanne, why don't we advance to the next slide, and you can talk a little bit about what you've done in your role and what you've learned from your work.
Certainly. Thanks, Eve. So Eve talked about some of the reasons why we do reflective supervision for our family partners, but ideally it really does help manage some of the stress at work, and also the challenges of being in a healthcare setting when we're working with parents, and these folks are parents as well too. So they know some of the stresses that come along with that. So it's really helpful. And in fact, our meetings have gone from monthly to some people have asked for every other week. And then sometimes things are really tough and they ask to visit every week. And it's really amazing to see the effects of this. And I've seen people grow drastically in their working abilities. But I wanted to share a quick story with you because I'm looking at the time as well. So I remember praising one of my family partners for the work that he did. And he was so shocked, like taken back by it. And I was always embarrassed. I was like, we all love to hear that we do a good job. So I said to him, I'm going to give you a homework assignment. I was like, one of the parents you work with, I see the effects of the praise, what it did for you. I want you to give it to somebody else. And this family partner came back and told a story about how, because I showed him how to give praise. Because remember, guys, like we don't always know, like not everybody knows how to play with their children. We give workshops on how to play with your kids. Sometimes you're just not taught how to. So he talked about what the praise did for him and how he in turn did it to another parent who just so happened to be a dad. And he said, you're doing a really good job as a parent. You're doing this. This is great. And then he saw the power of that praise and what it did for that parent. And he was like, it was just overwhelming to see another person get excited over hearing that they did a good job. But in turn, that other parent who was a father did it to their child, started to praise their child more verbally, and saw the effects of what that did. And I just really thought about the cycle. The family partner wasn't used to it, but gave that information to the parent, and the parent then gives it to that child. So it was unfamiliar territory. We dealt with the shock, and I gave him permission to give that praise, and then the parent gave the praise. And when I think about what that does, it creates emotional safety. You all know what it does, how it alters child development. And it was also a big generational shift. So the family partner gives me lots of credit. It could be a little overwhelming, but when you step back and look at that, you teach the professional gives it to the family gives it to the child, and we see an amazing cycle, a good cycle. Thank you, Eve.
Thanks, Roxanne. So I think that those are the end of our slides, so I'm not sure if we're supposed to offer our questions now or at the end.
Yeah, thank you for that question. It's a good question. Mara, after we hear from all the states, you all will have the opportunity to choose the breakout. We're going to have 3 breakouts, one led by each of the states that you're hearing from today. And so what each of our folks are going to share with you now is what you might ask them about. They're going to try to pique your interest to get you to join their breakout. And so Eve, yes, Roxanne, please share your questions.
Okay. So we would offer any questions around how we've worked to kind of integrate our Title V and TPEC and pediatric medical home activities. Happy to talk through what we've learned from partnering with practices to integrate family partners, both bumps along the way and success stories, as well as how we've worked to develop cross-sector and cross-agency partners focused on strengthening the family partner workforce, and also talk about kind of our lessons learned in partnering with families along the way, both at our program level and at our partnering practices.
Great, and I see a few questions in the chat, but we'll get to those in the breakouts when we open them up. Thank you both for sharing.
Thank you.
All right, and next up, we're going to go to the Ohio Department of Health. We have Maria and Amanda sharing on behalf of Ohio today.
Hi. Thanks, everybody. My name's Maria Jarosik. I work at the Ohio Department of Health, and I oversee the early childhood health management area. And we're going to talk about partnerships and collaboration. And so I will let my colleague Amanda introduce herself at our sister agency.
Hi, my name is Amanda Waldrop. I'm the with Department of Youth, or Children and Youth, and I'm the manager of maternal infant wellness in our community initiatives area under Outreach and Engagement Division. And I'm over our maternal infant vitality and some of our home visiting programs.
Next slide. So I'll kind of start to give you an idea of kind of how we place it here. This is just kind of a brief snapshot of our action plan and priorities from our MCH block grant. You can see we have 5 different groups that we break into: women in health, peri-infant natal, child health, adolescent health, and our child and youth with special health care needs. And then we have a cross-cutting, do we do it? And if you look at some of the key words in each one of the areas, a lot of them that you're going to see is supporting, improving, increasing, collaboration. And so that's really what we try to do. And Amanda will speak to DCY's role, our sister agency, and how we work very close collaboratively across 2 different state agencies, but the overall work may be different, but the ultimate mission is the same, and that's to improve the health of all of our children. So next slide. So here's the priority for the child, and it's kind of broken out from that other one, is just to improve and increase the support systems for positive health outcomes. And the range really is kind of that continuum of care and continuum life. We want to see a transition from each one. So our needs assessment showed that obviously in Ohio, people still want to improve nutrition, physical activity. They want to increase supports. A lot of prevention work and educational resources is important. And they want to encourage for cross-agency and state collaboration at the state level as well into the local level. And so that's what we kind of really focused on in this 5-year cycle, is how can we take all of our programs and expand them and really build those partnerships. So it's not one person doing all the work or one agency. Each person has a different role. Next slide. So again, in the child group, we have 3 objectives, and really the highlight again is the collaboration and coordination and looking to increase the percentage of children and thinking about more educational opportunities. This year, or this grant cycle, we brought in the 3rd one to really build on increasing healthy environments and looking beyond the fact that it's just food and in school, that there's a whole bunch of pieces that go together. So really trying to figure out how we can work around the state and make a healthier environment for all. Next slide. Again, as I said, the partnerships are what is most important when we work through this. Our agencies, the Department of Health and DCY has a lot of different programs, and they all may hit different audiences, but part of that is to develop those partnerships. And we do that through different school supports, home supports, medical supports, really trying to bring that all in and engaging the community. We focused a lot, and I know Amanda's team has taught a lot, and she'll share a lot on how we bring that community voice to inform what we're doing and make sure that we are meeting the needs and closing that feedback loop. And we do that by gathering together, educating, and sharing resources. It could be screening tools. Ohio is locally ruled so that each community may have different things, but trying to figure out how we can maximize and make that even and beneficial to those families. And again, providing resources and technical assistance that not only supports the families, but also supports the professionals that are helping support the children where they live, learn, and play. Next slide, please. So this is just a snapshot. It's a very busy slide, but this just talks about the early childhood health program that we have at the Ohio Department of Health. And it talks about the different programs that we really focus on in our little world that is more about connecting resources and education kind of at that state level. So we kind of focus a lot on, we call it ECOP, is our early childhood obesity prevention program. But through that, we have a program that we call Ohio Healthy Program that focuses on working with early childhood settings. And then we have Parenting at Mealtime and Playtime, which we call PMP, that kind of works with that medical end and home visiting. And then we have health and safety trainings that could be for really any professional working with families. And then there's other little things that we'll do, like we work with the Ohio Department of Education and Workforce on the farm to early care. So that's another sister agency that we are trying to work with to build this community and collection. Next slide, please. And then I will turn it over to Amanda so she can talk about all of their programming.
Thanks. So we developed a program that is really what we refer to as our central intake and referral system. So it's really an umbrella system for Help Me Grow. So anytime, it could be a medical professional, it could be a self-referral from a parent, a family, friend, a WIC provider who just thinks that a family might need a little extra support. They can provide this referral system into our central intake and referral. And then it leads to any of these other programs you see inside the door. And then I'll talk about a little bit more about those on the next slide, if you keep going. So first we'll talk about just our community referral system. So any of these different types of community resources we have available for anybody who would need them. You can see they're across the state. So in each community, they could be very different. But we have things like our community health centers, our home visiting systems, our 211, that's our, if you call in, you need assistance. Not every state has a 211, but in Ohio we do. Our nonprofit agencies, those could be different across the state. But again, anyone that's in the local community, people can add themselves to it. So if they're a local nonprofit agency and they want to be on the system, they can actually add themselves and say, can you please add me? And we can do that. We have over 13,000 across the state now. Next slide. To go. Oh, there we go. Then we have our ages and stages questionnaire. So this is free to anybody who wants to use it. Of course, it is parent focused, but it could be for, grandparents, people who have kinship care, anything like that. And it's for birth through age 5. And it's just trying to say, what are those developmental screening tools that we can use, games that you can play with your child. I know the last speaker we're talking about, like, you may not know how to play with your child. This has over 2,000 playful activities that you can actually do, and it's free to use for Ohioans. And we're very big success, and it's kind of exploded in the amount of people who've been taking advantage of that. And it's all about that kindergarten readiness, seeing if people are, our kids are ready for that. And then if they're not, you can put in a referral, and then we can take it from there for our EI supports or any other community supports that someone might need. Next slide. We do have several home visiting models in the state of Ohio. So we split them up into the ongoing home visiting system. So that's on the right side of your slide. So that's the 3 that you see there. And then the Family Connects Ohio on the left. That one is separate because it's just meant to be kind of a one-time visit, and it actually does not have any income requirement. So it's a universal model. Anybody can get one, no matter your income, no matter where you live in the state. We have that. It's not quite statewide yet. We're hoping to get there. But these models are available across the state. Each, as we've said before, we're kind of a home rule state. So each local community gets to decide what they want to have in their community. So some of them have one model, some of them have all 4. So what's really great about that central intake and referral is that specialists, when they get to talk to the family, gets to hear, what are their concerns, what are their needs, and then they get to refer them to what's available in their community based on their needs. So they can show them what's available to them. And you can see this it goes across the gamut from prenatal all the way up to age 5, depending on what that family needs. Next slide. And then I also wanted to take a second to talk about our infant vitality work. So in Ohio, unfortunately, we do have one of the largest disparities in infant mortality for racial disparities in the country. We're not very proud of that, but it is something we want to acknowledge. So we take a focus in these 10 counties that are across our state. They make up 88% of the deaths for non-Hispanic Black babies across our state. And 60% of all deaths in Ohio occur in these 10 counties for infant mortality. So we really do focus on this work. We're able to provide additional supports in this area with neighborhood navigation to provide support. It is not income dependent, but we do try to target areas with the highest level of need, so down to zip codes, things like that, to provide that navigation into additional supports.
I'm so sorry to interrupt, but just we have time for the breakouts, just one more minute, and then we'll need to wrap up. Okay.
Oh, no problem. Next slide. That was my last slide.
I think there's one more slide for the questions, ask us. Yes. So if you're curious, some of the things that we could do is kind of, talk about how we cross agencies from state level to local levels in a home rule, how we work together to overcome barriers, and again, engaging voices into the work through different audiences, as you can see there, and then bringing home education and medical together at the same table to benefit families in Ohio.
Thank you both, and encouragement to attendees. If you have questions specifically for Ohio, you can pop them in the chat and then we'll make sure those get asked in the breakouts. And I am going to now turn it over to Abby in South Dakota. I just want to reshare my slides once I get back there.
Hi, thank you all so much for having us. We're really excited to be here. Jason Simon Ressler, he is our child health coordinator for the state of South Dakota, and he is currently cycling across the state of Iowa. So I am pinch hitting for him today, but just really grateful and want to shout out to him the work that he did on these slides and the work that he's doing in this space. So this shows some changes that we've had in our priorities in the last, with the last needs assessment cycle. So we had really focused on parenting education and developmental screening, and now have shifted to child food sufficiency and medical home. So our top issues that we found in our needs assessment was tied to our children's environments. So South Dakota families have really struggled with finding quality, affordable childcare, and really rely on school meal programs and have struggled with food sufficiency. And also we found gaps in health insurance and safe housing. Our children and youth with special health care needs also had challenges with the various systems, our health systems and education systems, and it really reinforced to us why early childhood systems work and why they matter. When our childcare and nutrition programs, housing and health systems are connected, children have a stronger foundation for healthy development. We really have anchored into this triangle and a little bit of what was shared earlier about these partnerships with ECCS and MIECHV. And a couple of years ago, did a deep dive into these partnerships and saw that we were really working more parallel to each other rather than really together. So we have been partnering actively with our home visiting programs in the state, as well as our ECCS programs in the state. And found that we had a lot of shared priorities and also could really leverage the work of family engagement that each were doing in their separate spaces. So we really came to appreciate this collaboration triangle and how we could maximize our partnerships. So this is an example of some of the work that we've done, and I will put a link in the chat to some of the data work that we were able to do with ECCS. And through this shared partnership and work together, develop out some needs for our educator training and really understand the space more, but we couldn't have done it without that partnership. So this shows a lot of the different places that we are partnering. A lot of the Jason has gone all over the state in conferences and events, and really see this as several opportunities for us to present, but also be present. And also the main goal is to connect and build our network. So we are there presenting our resources, but really we're also there to build those relationships and understand who else is in this space in our state and how can we work closer together. Every conversation strengthens our network, and we're a small state agency, so we have to work with each other and we have to work with our systems to really make an impact. The other thing that we have found is the value of connecting people with other people. And so especially we found this with our ECCS network is as we have really leaned into that partnership, they have connected us with others and we have connected them with others to really strengthen that partnership. This is another tool that we have used and use continually. This is something, a little teaser that we're going to be jumping into in our breakout session, but really looking at the prenatal to 3 state governance. And what it does is it lays out the system and how the systems are structured in each state. So we used this to really look at where all the places early childhood was happening and where could we connect. So these are all of the places that we are connecting and the work is currently being done, and we're exploring this tool further. So if you are interested in our breakout, you can come and join us. We're also going to be having some discussion time to really learn from each other what y'all are doing in your states to build those strategies and those ideas in us. One thing that we have really learned from all of this work, especially that triangle, is what other states have been able to do with those partnerships and have found that really helpful. So that's what we want to share with you in our breakout.
Thanks very much, Abby. And I am going to turn it over to Mara to give some instructions for the Choose Your Own Adventure that we are about to embark on.
Awesome. Thank you. And thank you to all of our fabulous state presenters. So we really wanted to create an opportunity just for everyone here today to, now that you've heard about how some of your peers are using collaboration to advance some of these shared outcome measures that will create these nurturing environment for children and young families, we want you to just spend some time with them, learn more about their work, ask questions. And so we're doing a create your own adventurous situation here where you're going to be able to pick the breakout room that you'd like to go to. But hopefully you all enjoy that time in the breakouts, got to connect a little bit, and learned more from each other, and are leaving today with some new ideas, questions you might want to bring home to your team, things you want to follow up with any of the presenters or the AMCHP team about. So just to close out really quickly, we are really excited to share AMCHP has, the South Dakota slides earlier had that triangle that was from this original AMCHP resource we developed several years ago. We have revamped that resource. It's our Aligning Early Childhood Systems 10 Recommendations and a Roadmap for Action resource that'll be coming out in the next couple of weeks. That has been designed to be much more usable. It's basically a guide that's going to help you walk through, regardless of sort of what collaborative capacity you're engaged in now, what that might look like to work with other folks to advance some shared outcomes. And so anyone who registered for this webinar is going to get an email with the resource once it's out, but you can also follow AMCHP on any of our social media handles here, and we'll also be posting it there as well, and are very excited to share that with you all. And just wanted to thank everyone who joined today. I feel like this webinar in itself is sort of collaboration in action, from our federal partners to all of the incredible state presenters, to everyone who really did some behind the scenes work to make this happen. So we're just extremely grateful to everyone. Thank you all for participating. I know that there's a lot happening between Title V block grants being due, other applications that you all are applying for. So thank you all for making the time. Please don't ever hesitate to reach out to any of us on the AMCHP team to get connected further, ask us any questions, and see how we might be able to support you moving forward. Paige or Anna, do y'all want to add anything?
Thanks for wrapping us up, Mara, and thank you everyone for joining us today. Take care.